In this video, I will describe how to perform a manual muscle test for the lower trapezius fibers and their action, which is going to be depression, scapular depression, and scapular adduction. So my patient's going to be in this prone position. I will have already assessed active range of motion on the unaffected side, the left side. I've assessed his active range on the right side and his active range while I'm palpating for the lower trapezius, close to the inferior angle of the scapula. And now we'll show you how to perform the resisted test. So I'm going to ask Eric, you'll notice his shoulder is in approximately 145 degrees of elevation. That's going to be the starting position. I'm going to ask him to turn his thumb up towards the sky. That places his glenohumeral joint in neutral rotation. And Eric, can you lift your thumb up towards the ceiling? So I can palpate here, but as I perform this resisted test, I'm going to palpate a little bit, but I'm also going to stabilize on the contralateral scapula. So Eric, can you bring your arm up towards the sky again for me? I'm going to apply my resistance just proximal to this wrist joint, and it's going to be directed straight down, which is going to cause the opposite motions at the scapula. And as you can see, this, even holding this position, is quite difficult. So can you come up towards the sky for me? Hold nice and strong. Don't let me move you. Hold, 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 hold. Good. And if he's able to resist against maximal force, that would be a grade of 5. If he's only able to resist against moderate force, that would be a grade of 4. If he's able to go through that range of motion, but he can't take any force, that would be a grade of 3. If he's unable to do even that, what I'm going to do is I'm going to bring my arm under. I'm going to cradle right under the glenohumeral joint so that I'm supporting the full weight of the arm. And I'm going to ask him to perform that motion, that lift motion of the arm, but really what I'm looking for is the motion at the scapula of adduction and retraction, and I can palpate here as well. So if he's able to move that scapula in those motions, he will attain a grade of 2 as I'm supporting the weight of the arm. If he's unable to, but I can feel muscle contraction, that would be a grade of 1. If he cannot even contract the muscle, I don't feel that muscle working with palpation, that would be a grade of 0.